Hi, everyone. Well, for those of you who know me well, you've probably already thought, geez, oh man, what is Paul doing now? He's joining the rest of the bloggers out there in the world doing this video blog thing. Who would have thunk it? Well, you're partially right, because I've always been a person who has really loved technology, and I've always tried to think of ways to use technology to either have fun or to advance a position or to make work easier or to make work more fun or whatever. So yeah, in a lot of ways, you're probably right that it's no big surprise that I am using video and YouTube to try something out, and hopefully it will be something that I will keep up with. The main purpose for this blog or this diary or this, if any of you have an idea for a name, let me know, and I'll certainly give you credit for the name, because I don't have any idea really. The main purpose for this video blog is to chronicle some pretty major changes that are coming up for me, and to keep all of my friends and family aware of what's going on in my life. It's easier than emailing, I think, although I'm a little nervous. I'm not used to talking to the screen. I have nobody to argue with, and you all know that I like to argue and debate, so there's nothing really. The screen's not going to do that. Tucker might make some noise because he usually gets jealous if he thinks I'm talking to someone on the phone or not paying attention to him, so that might happen at some point. Geronimo is out in the kitchen looking up at the counter. I moved the cat's food because Geronimo can't jump up on the counter anymore because he's just getting too old, and so I moved it, like a month or two ago, and he still sits out in the kitchen and gripes and moans because he wants me to lift him up on the countertop, when in fact there's nothing on the countertop anymore for him to have. The food is on the table behind me, which he can now just get up on a chair and then get up on the table and eat the food. Because of course the food has to be separated from the floor, because if it weren't, then Tucker would eat all of the cat food and the cats would go hungry. So anyway, down to what this is about. Two things, really, two major things. For those, some of you may know that I have decided to have bariatric surgery or weight loss surgery, and many of you know that I have been working on this for probably at least, I would say actually, I was going to say at least 3 years, but actually probably more like 4 or 5 years. I started the whole process by going to an information session when I lived in Corpus Christi, and at that information session I was actually able to see the surgeon who would be performing the procedure, as well as a nutritionist, and as well as a psychiatrist, because most all bariatric programs require or have a psychological component that they want to make sure, obviously, that you're in your right mind to take on such a major change, and also that you have a support system in place to help you. And in addition to that, I think I also saw someone about the finance, the insurance and financial part of it. So I went through the whole process in Texas. Found out there that my insurance in Texas required me to do a 6-month doctor-supervised weight loss and exercise program. Excuse me, which I did. And about the time, I can't remember exactly the time. That's the other reason I'm doing this, is I'm going to try to chronicle this stuff in order, so that if there's ever a question in the future or I want to know something, I can look back. But at any rate, about the time that I finished the 6-month program, I had to weigh in once a month with the doctor, and obviously I had to attempt to reduce my caloric intake and increase my exercise. About the time I was finished with that program, that 6-month program, I actually got the job here at Illinois State and ended up moving. And then, of course, the first, I would say, year and a half that I was here in Illinois, I really didn't pay much attention to the whole idea of bariatric surgery or anything, because I was settling in here, buying a new house here, and getting used to my job and all of that kind of stuff. And so about last November, by the way, today's August 2nd, 2011, and happy August to everyone, and happy signing of the debt ceiling bill today. I'm pleased about that. I'm not necessarily pleased with all of the content of that, but I'm pleased that we didn't default on our obligations. At any rate, so where was I? So last November, I asked somewhere around there, I asked my primary care doctor here in Illinois if he would support me considering bariatric surgery, and he said of course he would. And so he originally he referred me to a surgical group in Champaign, Illinois, Champaign and Urbana, which is where the University of Illinois is, different from Illinois State, for those of you who don't know the nuance. Anyway, I met with the surgeon there. I wasn't all that hot for this particular surgeon. And what ended up happening is that they never got back to me. They never followed through or anything like that. And when I tried to follow through, they were like, "Oh yeah, well the doctor's just kind of been busy, and this, that, and the other thing." And I was like, that's really not what I want in a surgeon. That's not what I want in looking more into this. So I went back to my primary care doc, and I said, "Is there anybody else?" And he said, "Well, yeah, there's a surgical group that's affiliated with St. Francis Hospital, or St. Joe's here in Bloomington. It's St. Francis in Peoria." And so he's referred me to the surgical group in Peoria, and I went and met with them, and I met with Dr. Marshall, who is the person that I chose, or the surgeon that I chose out of the three, just having looked at his experience. And I ended up meeting with, I think before I went to meet with him, I went to the information session, which is required, and met with the surgeon, and he basically told me that he thought I was a great candidate for the surgery. He suggested that I consider the duodenal switch, which is, and it will be laparoscopic. The surgery will be laparoscopic, so it won't be a full incision, but it rather points, about 6 different points where they go in and have tools that, so they don't have to open you up. And the duodenal switch, the gist of the duodenal switch is that basically they create a kind of a sleeve out of your stomach, and they take away, from what I understand, about 2/3 of your stomach, and you're left with about 1/3 of the size that you originally had. And that differs from some of the other surgeries, because the duodenal switch actually removes that portion of the stomach, that 2/3 of your stomach. It actually removes it. Excuse me. And so what happens is you're left with this long, slender, what they kind of call a banana-shaped stomach. And normally your small intestine comes out of the bottom of your stomach, and then that leads into your large intestine, I think. I'm always confused about small and large intestine. But anyway, the intestine that's closest to your stomach is actually cut from where it attaches to your stomach. And it's basically sewn off at the top. And then they take the bottom portion of the small intestine, where it used to lead into the large intestine, and they cut it also from the large intestine, but they reattach that end all the way down kind of at the end of the large intestine. They then bring the opening to the large intestine up to the stomach. So essentially what they're doing is they're bypassing the entire small intestine, but it's still creating gastric juices and all of that kind of stuff, and that's why they reattach it at the very end, because no food will any longer go through the small intestine, but it will still create digestive juices and stuff like that will aid in the absorption towards the bottom of the whole process. So anyway, this particular surgery, the duodenal switch, has the best track record for the highest amount of weight lost and kept off. And I've been told by a couple of, or I've been told by the doctor. Actually, at that time, there was two gentlemen who were coming in for their 12-month checkup. They had the duodenal switch about 12 months earlier, and they both weighed about what I weigh now, which is somewhere between 350 and 360. And for their 1 year checkup, they had lost 175 pounds, which is half of their total body weight, which is actually exactly what I want to do. And they were pretty much complication-free, which doesn't mean it's always that way, but at least they had a pretty good run of it. So, decided on the duodenal switch. I agreed with his assessment and thought that this is probably the thing to do for me. And so then we went through insurance, and my insurance, who at this time around was Humana. They also required a 6-month doctor-supervised exercise and diet program, and so I went through that entire 6-month thing again, then basically just finished that about a month ago, maybe a little bit more than a month ago, I went for my psych evaluation about 2 weeks ago now, and the psych visit went very well. The psychiatrist was really, really good, friendly, and all of that kind of stuff. And he said that he would expedite his report because here's the thing for any of you people in Illinois, any of my friends in Illinois, you know exactly what I'm talking about. But for those of you who don't, it's a mess. Our insurance is a mess. Basically, July 1st started our new fiscal year, and so the state basically cut a bunch of the insurance programs that were available to us, and one of them that they cut was the insurance that I was on. So I've had to choose another insurance provider, so I now no longer have Humana, I have Health Alliance. Fortunately, Health Alliance is not going to make me wait another 6-month period and do a supervised weight loss and exercise program. They have accepted what I did for Humana. And so that's great news. The problem is that Health Alliance is also on the chopping block, and they're going to. We did a 3-month. The state did a 3-month extension for Health Alliance. So really, that extension included July, August, and September. So at the end of September, or the 1st of October, that health insurance could be pulled as well. The health insurance that we're going to be left with is crap. I mean, it's going to, instead of an HMO, which is where everything is paid for except your copay, your office visits and stuff like that, they're going to probably more of like a traditional 80-20 program, which, 20% of a $30,000 surgery, which is probably what this is going to end up being, is a good chunk of money. And so I am I'm hopefully on a fast track to try and get this done before that becomes an issue. So what I got today was, I'll show you, I got, just after talking with the patient advocate coordinator yesterday from the Peoria Surgical Group, I got a letter today that said that I have done everything that meets their requirements, and they are packaging all of the information up and sending it to Health Alliance so that we get a response from Health Alliance as quickly as possible. And it says in here it can take 30 to 90 days to approve. Well, let me just tell you, if they take longer than 30 days, I could be screwed. So everybody please keep me in your prayers and that this goes quickly. The other thing that I found out yesterday when I talked with them was that, the first thing that she wanted to tell me was that, she said, I noticed from the report from the psychiatrist that you're still smoking. And I said, well, I am, because my understanding was that at some point here, once the psychological evaluation was done, that you would be calling to schedule the surgery, and that once you did that, you could say, well, it's going to be 8 weeks, or it's going to be 6 weeks, or whatever. And at that point, what I understood was that I had to be smoke-free for 30 days before and 30 days after. That was the minimum that I had to be smoke-free.